Hello patients, parents, and coaches. Today we're going to learn about an ACL tear. If at any point throughout the presentation you feel like you do have this injury, please seek medical attention. Today we're going to talk about what an ACL tear is, some of the signs and symptoms, some of the risk factors, some of the rehabilitation and care of the injury, and the prognosis, or what will happen in the future if you sustain this injury. We're also going to learn about what an athletic trainer is. And throughout the presentation, you'll see how an athletic trainer helps you throughout the entire process of sustaining an ACL tear. My name is Emma Nye. I am an Indiana State University Doctorate in Athletic Training student. I also work with the Indiana State women's volleyball team as their athletic trainer. So to start, what is an athletic trainer? You may have seen athletic trainers on the sidelines of football games, maybe the sidelines of a basketball game, running out to the middle of the court or field to take care of an athlete. But we also work in high schools. We work in colleges. We even work in dance studios. What we try to do is prevent injuries. We make sure that you're strong enough to perform and do what you want to do. This may be playing sports, playing an instrument, or just going to school. We also evaluate your injury. So if you sustain an injury, like an ACL tear, an athletic trainer will diagnose you. They'll tell you if you have the pathology or injury, or that you do not have the injury. They'll take care of you. They'll help you feel better by giving you exercises and treatment to make that injury better. We will also track your injury to make sure that you're ready to play or perform and that the injury does not happen again in the future. So specifically, what is an ACL tear? The above picture depicts your knee. There are multiple ligaments in the knee, but first, what is a ligament? A ligament connects bone to bone. It keeps joints stable. So an important ligament in your knee is your anterior cruciate ligament, or your ACL. In the bottom picture, you can see an athletic trainer performing a test to see if that football player has an ACL tear or does not have an ACL tear. So there are several risk factors that coaches, parents, and players should be aware of. First, if you are a female, you may be at an increased risk of sustaining an ACL tear because your body is built differently. However, an athletic trainer can work to ensure that you're strong enough so that doesn't happen. If you are overweight, you may be at an increased risk of sustaining an ACL tear, but an athletic trainer can give you nutrition suggestions. If, when you jump, you land incorrectly, you may be in an increased risk of sustaining an ACL tear. But again, an athletic trainer can help to ensure that that doesn't happen by giving you exercises and working with you to make you stronger. And the last risk factor, if you participate or play on turf rather than grass, but an athletic trainer knows what type of cleats that you should wear to ensure that you don't sustain an ACL tear. So what are you going to feel if you get this injury? Most likely you'll be running down the field or running down the court. Your foot will be planted on the ground and your knee will twist. This happens when you're changing direction. And as you can see in the picture, an athletic trainer will evaluate you when you show some of these signs and symptoms. You may hear a pop in your knee. You may have some pain. You may have swelling when you look at one knee compared to another knee. You may not be able to straighten, bend, or walk. And you may have a feeling of giving out, or your knee feels unstable. So what is an athletic trainer going to do? First and foremost, they're going to protect you. They're going to remove you from practice or your game to ensure that you don't hurt that knee again. They will likely give you crutches, an ice bag to control that pain, a compression sleeve to control that swelling, and they're going to get you moving when you feel ready. They will also work with your doctor so you can undergo some more tests to ensure that you do have that ACL tear, or you don't have an ACL tear and you may need to consider a different injury. The physician may prescribe an X-ray or an MRI to get a deeper look into your knee to make sure that you have that injury. The physician may recommend that you have a surgical procedure to fix that ACL tear. Once this happens, you will be right back with your athletic trainer. From this point on, as you can see in the picture, the athletic trainer will help you rehabilitate or make your injury better. They're going to protect the injury, they're going to control that pain and swelling, and they're going to begin to strengthen those thigh muscles around your knee. They're going to increase that motion or that bending and straightening, and then you're going to make sure that we walk normally. So what is the prognosis of an ACL tear, or what in the future is going to happen if you sustain an ACL tear maybe in high school? Well, first the athletic trainer is going to make sure that you are ready to play or ready to perform whatever activities that you want to perform. They're going to strength test the other leg to make sure the right is equal to the left. They'll take you through some functional movements, like a squat, a lunge, basketball, soccer, football movements, whatever is important to you, whatever you'd like to get back to. So an athletic trainer is going to help you return to play and return to life. Thank you for listening. My name is M&I, and this was an ACL Tear Get the Facts presentation.